Hi, good afternoon. Good morning, everyone. Very excited to see our numbers today. My goodness, I know people are very excited about today's topic. So I don't want to take up too much time, but I just want to say thanks for joining us. And we will be monitoring the chat. So pop your questions in there. If we're not able to answer it today, we're going to get a follow-up question and answer document out afterwards. So from here, I'm going to turn it over to Beck. Thank you.
Thanks, Maria. And hey, I want to echo Maria's thanks for you all joining us today. Really excited to have you here, and this is an amazing record attendance for our team, well, for JVSG anyway. So I'll go ahead and share. So look, if we haven't met before, my name's Rebecca Hayden, and I am the JVSG lead for USDOL vets. This session today is specifically for JVSG state veterans coordinators, program managers. So if you're not in that category, that's great. We welcome you. Other staff and partners may join us, but just be aware that today's session might not fully meet your needs because we need to focus today on meeting the needs of our program managers. There'll be plenty of other sessions and training opportunities later on for the rest of you. So we're here today to talk about VPL 0524 JVSG staff roles and responsibilities and coordination with WIOA services to veterans. This VPL, it replaced several other guidances, and it includes a lot of changes and clarifications about the JVSG program. These updates actually implemented feedback from you and from JVSG staff and from vet staff from the last 5, 10, 15 years. What you all told us was that the guidance needed to be updated, it needed to be consolidated, it needed to be easier to follow, and to give more examples. We think VPL 0524 meets all of that and then some. So here are the topics I'd like to cover with you today. So a few housekeeping notes. First, this is being recorded, and we will share the link with you to the recording as well as the slides. All of that can take a few weeks, so please be patient. And next, because I expect a lot of questions and we only have 1 hour to cover a whole lot of material, I'll need to take kind of a more organized approach to those questions in order to just cover the bare minimum. So I have benchmarks for myself throughout, and I when I reach a certain time on a certain slide, I have to move on. For the questions, let's focus today's discussion on what you need to know in order to keep your JVSG operations moving forward smoothly. So I've seen a lot of questions asking why vets made certain decisions, like how we got here from somewhere else. And they're valid questions, and they'll lead to some really interesting conversations at some point. But today we will need to focus a little on the necessities. So you can raise your hand to ask a question while we're on the slide that you have a question about. Okay, time permitting, I'll answer those questions as we go on. In the chat, enter your questions at any time. They'll be captured. We'll take a look at them later. I'm only going to check chat questions during this session at the end of each section of the presentation, so each topic. And that's, again, only if time permits. And then, of course, as always, although we welcome your questions, we can't promise to answer all of them today. So let's set the stage for the rest of our conversation by updating the way we talk about our processes and our customers. over the last few years, we've started using the word triage as shorthand for that process of determining a customer's eligibility to be referred to a DBOP. So now we understand, based on feedback, that triage is primarily a medical term. So medics triage their patients in an emergency to determine who will get the medical care first. So if you were a medic, or on the other hand, if you had a medical emergency, hearing the word triage, it could put you in a challenging mental space. So we're now referring to this process as screening, to be considerate of those individuals and to be a bit more accurate at the same time. Now, VETS is working with NBTI to develop a screening tool for states to use. NASWA developed a triage form a while back that many of the states have been using, and that's great. We, from a federal perspective, a form is a way to collect required information from a grant recipient. So therefore, we can't offer you a form on this. This isn't something that you'll use to give us information. It'll be a tool. It'll be optional, just as it currently is. We won't require states to use this screening tool, but we do want to put it in your hands because you have been asking for it. We've also, so we've used the term significant barriers to employment over the last 10 years. So it's again, shorthand for all of us. We don't mean any judgment when we say significant barriers to employment. It's just a way to describe a certain group of individuals. But now we understand that someone, if they hear, oh, you're an SBE vet, you have significant barriers to employment, that can be really demotivating or even insulting. And that's not the approach we want to take with our customers. And I know you understand that. So we're now just using employment barriers. It puts the emphasis on employment, a positive outcome. And we also think it's easier for a customer to swallow. I am seeing some people refer to these as QEBs for qualifying employment barriers, and that's fine. I don't think there's anything wrong with that. I personally don't need another acronym in my own vocabulary, but it should be okay to use. And then finally, HVRP co-enrollment is something that we started talking about in VETS in 2016 with VPL 0316. So we've included a section in this VPL 0524 that restates those requirements from the old VPL, but with the correct, but it includes the kind of the corrections that it needed. But you won't see the term HVRP co-enrollment there because there's a different meaning in WIOA for the word co-enrollment. We don't want that confusion to be out there. So now we just talk about serving HVRP participants. All right, I see a question come in and we aren't quite at that point. So we'll move on to our overview of changes. So first, here are the points where I think everyone agrees is a big win in this VPL. You love like you've already told us, you love the fact that DBOPs can now serve more populations. You really appreciate that consolidated positions can now be assigned at a half-time basis. I've heard lots about the plain language that we use and the customer service focus, as well as its layout so that you can find what you're looking for without reading all 24 pages of the VPL. So here's some other topics that we've significantly changed or just really clarified. And the only one on this list that I don't plan to go into in later slides is the NBTI participation. So there's a new section in this VPL that about NBTI participation, and it just increases visibility about the requirement for JVSG funded staff to complete courses on a certain schedule, and also that NBTI courses are available for other staff who serve veterans. It's not specifically for JVSG staff. We do have many courses available at various locations, various durations is what I meant, for staff who provide services to veterans. I will note, there are no new NBTI related requirements established here in this VPL. We put a lot of thought into grouping subjects together in the VPL so that it'd be easier to find what you're looking for. So I've outlined kind of the major sections here for you, but jumping down to the section 9 JVSG or AJC staff roles, I want to acknowledge that vets can't independently direct other areas of the state, non-JVSG recipient agencies, to do anything in particular, right? We have worked closely with ETA on this AJC staff roles section, and they're developing a TEAGL to address that part. So the TEAGL will be really similar to what we see in this VPL. It just wasn't administratively feasible to release them at the same time. I want to touch on the appendix as well. So it has the statutory definitions for our important JVSG terms like veteran versus eligible veteran, eligible person, and so on. There are links throughout the VPL that will direct you straight to the corresponding part of the appendix. It has some general informal explanations and discussions about each of those terms that we use, but remember, don't try to break it down like we have to break down every word in a statute. It's not really designed that way. It's just designed to give you an overview and help you organize the information. Nothing in that appendix supersedes what's in the guidance itself, or of course, the statute. All right, so JVSG program legislation is really specific and directive that DevOps shall follow this specific sequence when they're serving veterans. We've gotten away from that over the last 10 years, but we're coming back into compliance, and that is reflected in VPL 0524. The statute requires that DevOps serve eligible veterans in this order. First, special disabled veterans, second, other disabled veterans, and then, after that, other eligible veterans as set by the secretary. Here's what we think it looks like. That like a DevOps logs into work in the morning and has several participants on their caseload that they're going to work on this morning. They're trying to figure out where they start. We think the legislation is telling us that the DevOps starts with those special disabled veterans and then moves on to the other disabled veterans on their caseload. And then they proceed to the other participants that they're serving. Does it mean that they have to call their special disabled veterans at 7 a.m. when they log in because that's when? No, we're not trying to supersede or get away from good customer service. You don't have to call your participants at 7 o'clock in the morning because you're prioritizing them. It's just your casework that's where the casework starts. And over time, I really look forward to hearing from you on what that really looks like and how we can help. I am trying to, let's see. I want to make sure that I see a hand if it comes up. All right, there, got it. So up next, halftime positions. There are a couple points related to those halftime positions that we've introduced or at least formalized in this VPL. For consolidated positions, they can be assigned on a halftime basis. If your state already has approval to have at least one consolidated DVOP leaver position, you do not need to get prior approval to add on or to increase or reduce that number. So if you have a half-time or a full-time consolidated position and you feel like in that location it's most appropriate to change that to a half-time, then you're able to do that without getting prior approval. Please stay in conversation with your GOAT, your DVET on these kinds of changes. Of course, they can help you through it or help talk you through it. You do not need a grant amendment request in order to do this. And then, currently we have a couple of forms that don't support requesting half-time consolidated positions, but we have received OMB approval to change those forms so that they will allow you to request half-time consolidated positions. I expect to make that available to you over the next couple of weeks. And then next, for all halftime positions, those staff, we've specified in the VPL that they must have a separate login code from their non-JVSG work. It was implied, it was important before, but this is where we've laid it out, as a requirement. So this is really important because it helps to capture accurate performance data for your outcomes. And then finally, for halftime positions, we've added that they need to that the timesheet records need to prove that the staff worked on their JVSG role for at least 50% of their time. Now that 50% minimum for a part-time position, that's a statutory requirement. And then timesheet records, I believe that's already in financial regulations that are at JVSG specific. We just tied them together and put it in the VPL to hopefully to add a little visibility to it. Next up, so back to your feedback where you've asked us for more examples. I think the biggest area in this VPL where we've provided that for you are in the areas of JVSG integration into the state workforce delivery system and into leaver roles and responsibilities. We've been really intentional about identifying tasks that that we've heard have been assigned to JVSG staff in the past that don't align with the statutorily defined roles and responsibilities. We know that you, as the program manager, you don't want that to happen. You don't want your DevOps assigned to the front desk or other non-statutory duties. And we hope that the examples we've provided in this section of the VPL will help you approach your colleagues, your counterparts in other agencies or offices in your department with preventing any of those kinds of duties from being assigned to your staff. And then just a note about examples based on questions that we've heard over the last couple of weeks. Just remember that if we say, for example, or such as, we don't mean for it to be interpreted as all inclusive, like, this is exactly everything that the role needs to perform. And it's also not to be interpreted as a strict requirement, like you have to do every single one of these items. unless it otherwise says so in the VPL. Just remember to take it from that perspective. These are examples and intended to help. And then this slide shows you a few of the lever-specific verbiage changes we've made. So the old text from VPL 0314 is on the left, and then on the right, the new text from the new VPL with the changes highlighted. So these are good examples of slight tweaks to phrasing throughout the whole guidance that doesn't change our intentions, it just clarifies it. So another big move for us, and we've gotten mixed reviews on this part. In our previous guidance, we required that DevOps first serve their eligible participants. Once they had no more eligible participants to serve, nothing else to work on there, then case file maintenance. They needed to go through every one of their case files and make sure the documentation is there and the case notes are fleshed out. And only after all of that had been done did they have the opportunity to perform outreach. So we've reframed this a bit for several reasons, actually. First, what if there's a big networking event that is a great opportunity for a DBOP to network with other service providers in their area? Well, under the old guidance, they wouldn't be able to attend the event that day because they had some participant to serve or some case file maintenance that was needed. It was a bit limiting. I don't think it gave us gave you the flexibility that you need in order to deliver efficient services. So, and then at the same time, case file maintenance that's a really important part of delivering those effective and efficient services to veterans, to participants. It shouldn't be minimized by saying you only do this if you've done all of the other things first. It should be kind of incorporated into that flow. But the concept of prioritizing, of focusing a DevOps efforts on serving their participants, it's still very present throughout the VPL. It's up to the state to manage that caseload. It's up to DevOps to maintain those case files. And we've also clarified the concept of DevOps outreach quite a bit by very specifically saying these efforts should be focused on other service providers, other local service providers, not to the veterans themselves. We did give a helpful example of what to do if a DBOP is in that situation, they're introduced to a veteran, it can be a little uncomfortable to say, oh, I can't serve you, you haven't been screened. So we gave some helpful advice on how to provide good customer service by letting the person know about the AJC and how to get involved without actually providing a service to that person. I'm really surprised that I have not seen any hands go up so far. Thank you for letting me get through things so that I can, explain what I can. But I do hope that the questions will be flooding in after this bit. All right, so we've arrived here at kind of the weediest and I would say most interesting part of this slide deck.
Beck,
Yes.
there is one, there's the one chat that you saw early on, but a second one just popped in. What is the difference between a service and a conversation? Because it seems blurred.
Right. So the services are outlined in WIOA law, and I can understand how that can be a bit blurred. But we would need to open up the law and go through those specifically, and I don't think this is quite the time when I'm able to do that. But your question there, Mark, will be included in our Q&A. We'll make sure to try to address it there. Did you have a specific, before I move on, do you have a specific situation in mind that you wanted to talk with the group about at this time? Or are you content to go ahead?
It was just a question, and thank you for responding. Sometimes our folks are out in the field and we don't do any services out in the field. We communicate to refer them back to the Career Center for proper screening. But it just seems a little like you stated earlier, you don't want to give the impression that, oh, I can't talk to you because you haven't been properly screened. So when you're at an event, folks are going to approach you as soon as they see your banner on who you represent because they want more information. And so we refer them to get more information, go to your local career center and get screened and so on and so forth. But the way the reg is written, in a sense, it almost makes it seems like you're not even supposed to talk to these individuals.
Sure. That is some feedback we have heard in the past, and we hoped that our current language in the VPL clarifies this quite a bit by giving you something that the DVOP can say without it being a service. And with training and maybe practices, and we are also working to update the NBTI courses to train DVOP. You know, we want to prepare DVOPs to have those conversations while staying on this side of the law, on, you know, not providing a service to someone who's been screened. So thank you for bringing up that continues to be an issue for your state. We will stay focused on it. And I have seen many questions come in. Jeff, you've got your hand up though, so please go ahead.
I was just wanting to, excuse me, that first bullet, the head of single parent household, if you could address that one.
Okay, I have not gone through this slide yet. So again, I do plan to address these pretty individually. So I will do that. And looking at time, it is time for me to focus on this session. So I do see that there are more questions in chat. We will get to you one way or the other. But for now, let's talk about, you know, as Jeffrey requests, these eligible population changes. So we've added some employment barriers that would qualify an eligible veteran or eligible person for DVOP services. Shown here, the first one is head of single parent household. The individual would need to attest that that's their status. So a single parent household of one or more dependent children. It would be difficult to put exact parameters on every little thing. It just makes your job more difficult. But like, as someone who was a head of a single parent household, I knew who I was. And I think your participants who come in and say, yes, you know, I have served in the military, or my spouse has served in the military, and you proceed through the screening process, I almost said triage, that person will see head of a single parent household and be like, yeah, that's me, or no, that's not me. So we, you know, if there are specific individuals who have a question about that, who aren't sure what that means, we'd love to hear about it. But I do think it will stand on its own. Next up, we have added unemployed as an employment barrier that that would qualify someone for DBOP, or an eligible veteran or eligible person for referral to a DBOP. For the term unemployed, it's a technical term used by the Bureau of Labor Statistics. We, like, department-wide, when we say unemployed, like an unemployed person, then we're thinking of, uh-oh, we've got some feedback. Take care of that. Okay. So the technical definition of unemployed, please refer to BLS for that, because it's pretty specific. Next up, any documented disability. It doesn't have to be service connected. And then we're not asking you to collect that documentation from the individual. We are asking you to allow or to accept the person's self-attestation, their check mark on the screening tool, or whatever the case is, however you're screening them. Like, I have a documented disability, and that's the level of, that's the standard. And then we've gotten a lot of questions about this fourth one, referred from the U.S. Department of Veterans Affairs representative. So a representative of the U.S. Department of Veterans Affairs has referred the person for employment services. So the fun questions I've heard on this part have been, well, what if it's the groundskeeper at the VA? What if it's the phlebotomist and they happen to mention that the AJC can help? As you think about your role in your state agency and the things you do as a representative of that agency versus the things you do maybe not necessarily as that you may just do as a part of a random conversation, that's where we ask you to focus when we're talking about this subject. So a grant recipient, like a HUD-VASH recipient or a SSVF recipient of the VA grant, that they're not a representative of the VA, they're a grantee. So it's a different category, all right? And then I've also heard the excellent question of, what if it's the State Department of Veterans Affairs? And unfortunately, no, that's not included in VPL 0524. It's just as stated, not necessarily an employee of the U.S. Department, the VA, right? Not necessarily just a VA employee, but a VA representative, someone who in the course of their duties on their job has referred the person for employment services. I've heard another great question, well, what kind of form or format does that referral look like? And also I've heard, does it have to be a VRNE participant? And the answer is no. We're not asking for the person to bring in any kind of a document showing that the VA has referred them. We're not. It's not restricted to VRNE participants. So hopefully that helps explain those. Not seeing hands shoot up, so maybe we've gotten there. I did see a question come in just now. How does referral need to be documented? I get calls from the PACT social workers. Is verbal referral enough? And again, we're not requesting any kind of a documentation. Yes, the person who is being screened for eligibility for the DBOP would self-attest. A VA rep told me to come here. That's all we need. That's all we're asking for. Right, I'm gonna keep moving on just a bit. I do see more questions coming in, and I'm really happy to see that. I want to focus on those, but I have to do this for the benefit of our target audience. Okay, so in addition to adding employment barriers, we've also removed certain limitations. Specifically, in previous guidance, we said that a recently separated service member, which is defined as left the military within the last 3 years, that person could only be referred to a DBOP if they had been unemployed for 27 weeks. We removed that last part. So if you're a recently separated veteran, so you have left the military within the last 3 years, that is enough of an employment barrier to get you that referral. And then finally, transitioning service members, which is one of our additional populations that are authorized in statute. In previous guidance, we required that the career readiness, that in order to meet the criteria of in need of intensive services, as our appropriation says, that meant that the person had been deemed as not meeting career readiness standards when they during their process of out processing from the military. Anyway, so a TSM, a transitioning service member, currently in the military, if they have participated in any part of TAP, not completed, but participated, not a specific workshop, but any part of TAP, including the initial counseling part, that's all they need. And of course, for all of your participants, they would need to self-attest that they are interested in receiving at least one individualized career services. And we'll talk about that. I think that's next. I'm just checking again for hands up. I lost my, there it is. Okay. Okay. Eligible population changes, and then we'll move into screening customers. So in this VPL, we have formalized the fact that it is okay for your system, whatever it's called in your state, your system can be the one that screens participants and refers to the DBOP. They don't need to be screened by your system and some kind of manual intervention where they have to talk to an AJC staff first. It is okay as long as your screening criteria are set up in your system correctly, then it is okay to for the system to send that person straight to a DBOP. And then additionally, about screening customers, we do need the participant to affirm that they're interested in receiving an ICS. What does that look like? I mean, we have a couple of ideas, but welcome yours as well. One way that can look is someone simply ask that the system or the AJC staff who's screening can simply ask, are you interested in receiving one-on-one career counseling or training services? That should capture, sort of summarize the need here. If the person says, yes, that sounds like something I'm interested in, then they're interested in receiving one or more individualized career services. And, that's good. The screening process can continue. And then another way is to say, are you interested in any of these services? And let's say it's through they're enrolling or being screened through your MIS. Pop up on the screen this list of individualized career services that could be available to them through through their work with the DBOP. And they don't have to say, yes, I want this, this, and that. They just have to say, yes, I'm interested in at least one of these. And then that meets the criteria of confirming their interest. Now look, the purpose for all of that, for that making sure they're interested in an ICS, is to make sure that DBOPs have adequate time to serve their participants. So if the participant is only interested in a basic career services, here, I need someone to check over my resume, or I just want to use your computer resource room, we think that that person would be not best served if you like force them to the DBOP before, so that the DBOP can talk to them about all those services before they get to what they're really there in the center to do. So like on both sides of this, we think it leads to more effective and efficient services to DBOPS participants. It saves DBOPS time, and it gets the participant, the customer, where they want to go. Now, within all of that, we just want to make it clear that states, like you manage DBOP caseload numbers. We don't require that DBOP serve a certain number of participants, or we don't set minimums, maximums. And we really think that the quality of services that your DBOPs deliver is more important than the quantity of participants they serve. So when screening for eligibility, you should keep in mind that not everyone who's eligible for DBOP services has to be referred to the DBOP. If your DBOP is overloaded, if there's no DBOP available in that location, whatever the case is, I just want to acknowledge that you as the program managers have that latitude, that flexibility. You can set a caseload cutoff by the number of cases a DBOP is assigned to prevent overload. You can work out some way of intervening or, referring someone back to other AJC staff if that's needed in this case. So, and these are just ideas thrown out. Just emphasizing this is your arena. I have 3 minutes before I have to move on to that. I'm at the end of this section, so let me check chat. And I see there's a lot, and not sure where to start. So, does anyone, first of all, want to help me out by putting their hand up and asking a question out loud? Please, Adam. Adam, if you can come off mute and ask your question.
Okay, yes, I have a question with the new screening regulations here. Does a veteran have to have an active Wagner-Pizer app for the DBOP to work with them, or if they're registration only, can the DBOP go straight to working with them? We kind of get a logjam with working with vets because of that Wagner-Pizer app. We've been having to get them referred to us.
You're referring to a Wagner-Pizer app? I have never heard of this term, and I'm so sorry, but we'll have to, like, this is recorded, so we'll have to parse out your question a little more closely, unless you know how to help me out.
Let me see if I can rephrase it. Well, let me see if I can put it together.
DOL for the activity codes.
I'm sorry. It's too interlaced with Wagner-Pizer for me to immediately be able to help you out at this time. So we'll have to take that down for a future answer, okay? So sorry. Seth, your hand was up next, so please go ahead.
Thanks, Beck. Took me a minute to figure out how to get the mic unmuted. Seth from Washington State here. Just one question. It's long been the assumption that the priority service eligible population, that about 30% of them will meet DBOP eligibility. Old guidance said just because you meet DBOP eligibility, they must be referred. New VPL changes that, right? It says we finally asked the customer, do they want this service? I'm just wondering if VETS has any forecast out of that priority service eligible population, of those that meet DVOP eligibility, is there an anticipated percentage of how many will want that DVOP service? Would it be 15% of the priority service eligibility population? Do we have any guesses at all?
No, I'm not going to lie to you and make up a guess off the top of my head because we don't know. And then I also want to clarify, you said that previous guidance demanded that a DVOP eligible person be referred to a DVOP. And I just want to clarify there that the old guidance said that in one section of the VPL, and then it said something completely different in another section of the VPL. The intention was never to send 100% of DVOP eligible persons to a DVOP. It was a mistake in, like one word was in the wrong spot in the last, in a previous VPL. That wasn't the intention. And the 30% estimate, I am not sure where that data came from because it was long before I joined the team in the national office. But we haven't put forth any updated estimate on how many or what percentage of priority of service eligible persons would be also DVOP eligible. Interesting question though, as always, from Washington. Mark, you've got another question for us?
Yes, ma'am. Thank you. Some of the states utilize a platform developed by Geo Solutions. And whenever we put in a change, they don't make a change or an update immediate unless multiple states have the same issue. And so my question is in here was, now that our target population has expanded, this is going to create some false positives in our system because the way it's set up now, it does not recognize these new target populations we can assist. And with the pending upcoming US DOL audit, how do we address this issue?
Great question. I was really hoping someone would ask this, so thank you. You've done me a huge favor. I do know that many states have that exact same question. It's important to remember that we've added eligible populations. We haven't taken any away. So and that not all DVOP eligible persons have to be referred to the DVOP. So your current setup with GeoSol, it doesn't put you in a position where you're going to violate any rules. Like you're not going to get in trouble for not referring someone to a DVOP who is eligible. The audit doesn't check for that. They only check on who was referred to the DVOP. And then as far as the system is concerned, I don't think it should result in any false positives. It will screen out some individuals who should have been let through and referred to the DVOP. If you need time to implement this, and we know that GeoSol isn't going to have this updated tomorrow, it is okay to take the time that you need to add these additional folks who are eligible to your screening process. Don't be concerned about the audit in that respect. The audit is not going to issue your DVET is not going to issue a finding when we know that you're working hard. You're just as interested in serving these additional folks as we are. I hope that addresses your concern. And Rick, you've got your hand up next. Oh, did you have a follow-up, Mark? Okay.
No, I was going to say thank you because we have to update our training for Wagner Pfizer staff to include these additional populations. So thank you.
No, we totally know that much work that, the work is ahead of us for all of us on this transition. Rick, go ahead.
Yeah, we went through an audit last summer And I would say for those that are getting ready for an audit, whenever we've had a situation where the system wouldn't take it, and yet we put them in because they requested those services, we notated that. And to us, that never got us in trouble for any reason whatsoever. And I would hope that would be the same for those folks that are in that situation right now.
Rick, you've hit on gold right there. Documentation. When there's something up with the system and it conflicts with something else and you have any doubts at all, document in the case file, just as Rick has explained, and this will help you a lot in the case of an audit. Thank you so much for bringing that up. Oh, I do see another hand up, but unfortunately I went past my time. I need to talk about our transition plan a bit, and then we'll see where we are time-wise. Okay. For transitioning, we've already been talking about this a little bit. We know that it takes time for you to implement changes that are this big. We don't expect you to change everything on a dime overnight and implement all of this. So your goaters, your DVETs, they know that you're going to need time to work through all of this. So when they're conducting your audits and as they're reviewing your 4-year JVSG state plans that are currently in progress, nothing is being kicked back for being compliance with the previous guidance. We just released this a few weeks ago. We know that it'll take time for that to filter down to your state plan. In audits, you may get a finding issued for something that's non-compliant with the new guidance, but there is latitude there to consider that an issue resolved as we understand you are working on implementation. And then reminder about that forthcoming T-goal that addresses the Section 9 AGC staff roles. ETA is working on that, and that will help you with the other part of your transition. For the timeline, keep getting the question, when do you expect us to have all this done by? We're not setting a hard deadline. We don't think that would serve you very well. And it would put us in a tough spot as well, frankly. So just, keep talking with your goater about it. You're going to need time to retrain everyone. I do ask that you document any updates, like your progress toward this in your technical performance narrative, your quarterly reports, anything you can add in there in your narratives to talk about this implementation that goes into the official grant record, and that will help us along the way. In the meantime, we are developing a number of supportive documents and updates for you. I've got a whole list here of plans and things you can look forward to. Specifically, I hope to see a lot of you next in a couple of weeks in Burlington at the NASWA quarterly meeting. And then we have a breakout session in the NASWA Annual Veterans Conference, and we hope to continue the discussion there as well. NVTI is also working on this on a webinar for JVSG staff, the DVOP eligibility screening tool and a flow chart. And then, of course, all of our courses will need some kind of update. It will take a lot of time, but we'll get there. Okay. And I know there's only a few minutes left in our hour together. We do have a hard stop at about 10 after, but until then, we can move to your questions. John, you have your hand up. And your hand's no longer up. Okay. Let's see, where to start. Under populations eligible for DBOP services, there's a note that says an individual who attests to having a disability claim pending with the VA.
I'm sorry, I'm back.
Oh,
Yeah, my mic went off. My apologies.
okay, yeah.
So on
Let's hear it.
slide 13 or 14, I can't remember when it was talking about the new population groups. One of them was the unemployed. So when I saw that, I just thought of something I had to ask. Does that mean when a veteran comes in and they have honorable discharge or anything other than dishonorable discharge, and they are just unemployed, we can then enroll them into our caseload and provide services? Because before with the SBEs, there was conditions. So I'm just confused about that. Is that accurate that when a veteran comes in who is eligible for DBOP services and they are unemployed with no SBEs besides being unemployed, we can enroll them into our caseload and provide services? Is that correct?
An eligible veteran or eligible person who is unemployed can be referred to the DBOP.
Okay, but enrolling into caseload and providing services.
That's what I may be missing. I may be missing a fine distinction that you're trying to make, and I'm so sorry.
Yeah, no, again, being referred is one thing, but again, being on the caseload, taking services in our system, that's what I'm trying to get clarification. Because I would love to have any veteran come in who is eligible for our services to help them. But before, with the SPEs, we were kind of restricted, so I'm just getting clarification.
Well, yeah, so it's not SBEs, it's employment barriers at this point. So yes, and the fact that the person is unemployed, that does make them eligible for DBOP services. And I'm sorry, like I hear now that you think that referral to DBOP and DBOP can serve them are two different things. And to me, there's not a difference.
Fair enough.
So
No,
that's why I was confused there. And thanks for bearing with me.
No, that's fine. Thank you for tolerating me and my question. Appreciate it.
It's great. So happy you asked. All right, next person with the hand up is Richard Gibson.
Hi, good afternoon back. Sorry, it took a second for the mic to turn on there, but I got kind of a technical question. So, you know, if it's gonna make the FAQs or whatever, that's fine. But when we're talking about the halftime staff and this requirement to have a separate desk code or login ID, can you elaborate on like what constitutes that? Because we do keep we have some halftime staff that right now our mechanism to make sure we're halftime is manager supervision and then different time codes in our timesheets. But it sounds like this is almost like something that wants to catch it more real time, like what they're working. Is that what I'm hearing? Is that correct?
Oh, okay. So you're talking about someone who is like part of their time is spent on management duties and part of their time is spent on leaver duties. Am I right?
I'm sorry. This would be so the specific situation is staff that are 50% DevOps JVSG funded and then 50% funded through another grant working different duties. Yeah. So the way we capture that right now is manager supervision of the schedule, and then our timesheets are charged accordingly to the hours that are worked. But this separate desk code or login ID, it almost sounds like, you know, when you log into the computer, you need to be logging in for what you're doing. Is that correct? Or
so here's where we're coming from there.
Yep.
It is hard to make sure that the work that's being captured in your system is consistent with the hat you're wearing, the funding stream you're funded by. If you don't have two separate logons when you tick a box in the system, like you did this thing for this participant, the performance data that goes in, it needs to separate, like whether it's a JVSG service or whether it's a Wagner Pizer service, some other grant funded service. That's what we're interested in trying to parse out here so that the performance data for your state is accurate.
Okay.
So
Okay, that actually does clear up a lot of things for me. Yep. Okay. So
good.
so if those two aren't conflicting with one another, we shouldn't really have any issues with that then, correct?
Well, I'm going to ask you to have a full in-depth conversation with your DVET on this issue so they can understand exactly where you're coming from. And if there's something that prevents you from complying with the VPL, then we can all talk about it and figure out where to go from here. Okay. Thank you so much for your question. I hope that actually helped a lot of people. Danielle, you've got your hand up next. Do you want to come off mute? I know there's a,
Oh, is that, can you hear me now?
yes.
So, and I just wanted to kind of, if it's okay, go back real quick to the previous question, for example, with the unemployment, if I'm understanding correctly. So in addition, that that veteran client would also be seeking DVOP or the individualized services, right? So if they're on unemployment and they meet that barrier, they would also be seeking the individualized services from the DVOP too. Is that right?
That's spot on. So question number one for anyone who is going to be screened for a referral, question number one should be, are you interested in receiving individualized career services? And if the answer to that is yes, then it's okay. Are you eligible veteran or eligible person with an employment barrier, or are you one of the additional populations that doesn't need an extra employment barrier on top of that? It sounds like you understand perfectly, so thank you. Okay. Gregory, your hand was up next. Go ahead.
Yes, ma'am. Thank you. I just had a question under the individual that could be serviced by a DVOP when it says disabled veteran, and then there's a note attached to it. And the second part of the note says a veteran with a 0% rating does not qualify as being entitled. Now it stresses veteran. Yeah, it's at the bottom of that. Yeah, right there. Oh, where's it at? Page 8, I think it is.
So we're looking for DevOps specialist roles and responsibilities, and
Yeah.
then under
Page 8 at the bottom.
Need to fix the scrolling. Enable scrolling. Okay. Where are we? This is page 8. Okay. An individual. Yes, I saw that you put something in chat about this, but I didn't understand what the question was.
Yeah, well, I was trying to put too much information, but what I'm asking is, it says, so a veteran, so is that veteran in general terms, or is that veteran as an eligible veteran? And does 0%, if someone has a 0, say they're an eligible veteran, right? But they're at 0% rating, does that mean they don't get our services then? They have to have 10 or 20? What is it?
Well, if they're a veteran, so this footnote is about the term disabled veteran.
Okay.
Right? Yeah, so it's about the term disabled veteran. Remember that we also have to, like, first you have to be an eligible veteran, and then you would be a special disabled or a disabled veteran, right?
Yeah.
You can't, like, there are some people who are a disabled veteran, but who are not an eligible veteran, and so they can't be referred to a DVOP for services.
So they cannot have a 0% rating. They have to get compensation. So a 10, a 20, a 30 on up to be eligible for our services.
They may not be eligible under this barrier, but they may be experiencing one of these many other barriers.
Oh, no, I understand. It's just,
Okay.
This goes back to another question another individual was talking about when they were talking about their Wagner Advisor application, making people eligible so that we can give them services. This is something you don't, this is state level figuring out the system. All right. Because just to let you know, that first part of that bullet there basically states that if they have a claim in under the bullet down there, number 2, the bottom where it says individual who attests to having a pending VA claim is considered to have an approved claim for the purpose of qualifying for the employment period. So they don't actually have a rating, but they have a
Mhm.
claimant. But
But
there's
once
nowhere
they have
in
a
our,
rating, right, once they
there's-
have a rating of 0%, not eligible.
yeah, so, but here's the thing is, but in our systems, just so you understand this, in our systems, we don't have a place to be able to mark this as an eligible. This is our systems, all right, in like probably 38 states. So in the past, what we've done is we've marked them as disabled 0%, just so the system can log them in as being eligible for SB services, JVSG grant.
Okay, well, this has not changed. This footnote is exactly the same as the
Okay.
previous guidance. So just to clarify, that's not new.
Okay. No, I got you. Just trying to get some clarification as we're trying to fix things in our system. Okay, thank you.
Understood. All right, thank you. We have 5 minutes to go before our recording stops. So Danielle, you've got your hand up for us again?
Hello, I don't know if there's another Danielle. But I did, and I just cannot find before the meeting I had a question and I can't find it in the actual, the VPL, but I thought I saw something in there that, the chapter 31s or the VAVR and EREPs, whenever they refer chapter 31s, is there a pre-screen that Wagner-Pizer should do prior?
Okay, yes, you're actually referring to, this is in section 9, AJC staff roles in JVSG. We have a specific part about the Department of Veterans, like the VR&E participants. It is true that not 100% of VR&E participants are automatically eligible for DVOP services. They must be they've been screened for services by the VA through the VR&E, but they need to be screened for DVOP services before they can be referred to the DVOP. Does that hit on what you were wondering about?
Yes, it does.
Okay.
Correct.
Michelle, you have a question too?
So, okay, so my follow-up question to that is then, if we receive a VR&E referral letter from the VA and they want a DVOP to work with this individual, is who's responsible for screening? Because right now the process is the referral is sent to the ISC and then the ISC sends it out to whoever's area it is in the state, and then the DVOP goes from there. So there is no Wagner-Pizer personnel in between there. So is the ISC supposed to screen the individual now?
There are no exceptions to the screening requirements. So someone, either the system or another AJC staff person must screen everyone before they're referred to the DVOP. And I understand the whole concept, the whole VR&E referral process it's a little bit challenging in many states. It certainly sounds like your state will need to update their processes in order to make sure that they're complying with the statute.
Okay, so I have another question then. Can you give me an example of a VR&E referral that we may receive that wouldn't be eligible for services other than not wanting intensive services?
Okay, so the person would have to be an eligible veteran. If the person did not complete 180 days of service, or it's actually more than 180 days. So more than 180 days of active duty, so that doesn't count training. They left the service and then they realized they had, some possible, they filed a claim with the VA to get a service-connected disability rating. That person, they didn't leave because of their injury. They left for some other reason, and then they subsequently filed that claim with the VA. That person would be a veteran, and they would be a VRNE participant, but they wouldn't quite meet that criteria of an eligible veteran.
Okay, thank you.
Thanks for your question. That's another one that we do hear a lot. Jason, okay, so I have to say, we're at 10 minutes after the meeting. I believe the person who was recording this meeting was not going to be able to continue recording after 10 after. I am happy to stay on with you and continue our discussion for a bit, but just be aware that at this point, the recording is going to have to stop, I believe, and won't be available to us after the call. So with that in mind, Jason, would you like to answer or ask your question?
Yes, ma'am, if I could. I think it's a quick one. I have a DevOps that came to me because he has an individual that has an unclassified discharge. The unclassified usually means they get out before they hit the 180 days. This person unfortunately has 185 days. So it seems like there's a loophole where an individual that would not normally get services is asking for services. So I guess my question is,